Hi everyone, today's harm reduction video is around the safer use of prescription drugs. First of all, I would like you to think about the following questions and answer them in your head. Have you ever taken a medication in a way or dose other than prescribed to you? Have you ever taken someone else's medicine? Or have you ever taken medicine only for the effect that it causes, such as to get high? If so, then you most likely have misused prescription drugs in the past. A prescription drug can be anything not sold over the counter, usually prescribed by a doctor. It includes prescription pain relievers, tranquilizers, stimulants, or sedatives. I'm going to start talking about some of the most commonly utilized and misused prescription drugs out there. Pain relievers help to relieve pain. They include opioids such as Vicodin, Oxycodone, Percocet, and morphine. Most people misuse pain relievers because they're in pain, while a smaller percentage misuse pain relievers to feel good and get high, to relax, or to help with sleep or lingering emotions. Prescription tranquilizers are often prescribed to treat anxiety or muscle spasms. This includes drugs such as Xanax, muscle relaxants such as Soma, and more. People misuse tranquilizers like Xanax to help them relax or relieve tension, to help them with their sleep. Prescription stimulants are often prescribed to treat attention deficit hyperactivity disorder, reduce or control weight, or to promote wakefulness because of conditions such as narcolepsy and sleep apnea. It includes amphetamines such as Adderall or other drugs such as Ritalin. Some misuse this drug to help cram for exams or to be more productive with their work. 75% of people who use prescription stimulants without a prescription use it to help them be more alert, to stay awake, or to help them concentrate or study. Sedatives include psychotherapeutics often prescribed to relieve sleep disorders such as insomnia. Ambien is an example of a prescription sedative. Most people who misuse sedatives did so to help them with their sleep. As mentioned, prescription drugs should be used by the individual to whom the prescription belongs and by the guidelines the physician recommends. If you choose to use without a prescription, practice safer use by taking the drug in small amounts. Avoid mixing with any other drug, especially alcohol. Have a friend with you in case of an overdose, or call a helpline so you don't use alone. Be sure not to take these drugs on an empty stomach. Eat plenty of food beforehand. And if you're using opioids, have naloxone around in case of an overdose. Many people misuse prescription drugs because they're experiencing chronic pain, anxiety, or trouble sleeping. Prescription medications are very powerful drugs that can lead to dependence. It's important to find alternative ways of helping relieve chronic pain, cope with anxiety and stress, and trouble sleeping. For example, acupuncture, exercises, massages, and herbal supplements are holistic approaches to chronic pain. Exercise, nature, sleep, meditation, and diet can help relieve stress and anxiety. And for healthier sleeps, avoid caffeine late in the afternoon or evening. Exercise regularly and create a comfortable sleep routine. Finally, some people use stimulants to keep them up and to help them study or increase productivity. Sleeping 7 to 9 hours a night can be very helpful. Time management and nutritious food can also help retain more information and improve productivity, and it is much safer than stimulants. Be sure to follow our student health social media platforms, which are going to be linked below. To summarize some of what I covered today, avoid taking medications not prescribed to you. It can have implications on your health since they're tailored for the individuals and their medical condition. 2. Research safer use for the particular drug that you're planning on using. 3. Keep your prescription drugs safe from others. When you're ready to toss them out, be sure to take them to a safe disposal kiosk. Most pharmacies also have safe disposal kiosks and take-back services. If you're getting rid of prescription drugs at home, be sure not to toss them in the trash or flush them down the toilet because it can be bad for the environment. Instead, crush the drugs with an unpalatable substance such as used coffee grounds or cat litter. Finally, be sure to call 911 if you or someone you know are using a substance and something does not seem right. Police officers and first responders are trained to help counteract a drug overdose, so be sure to let them know what kind of drug was used. That's all for our safer use of prescription drugs video. Be sure to like our video and subscribe for more content around harm reduction and substance use. Check out our website wellness.sfsu.edu for a list of events and programs. Have a wonderful rest of your days.